Hi, my name is Lofaro. I am a 6th semester nursing student. It is September 18th, 2020 at 8:45 in the morning. And I am going to be inserting a Foley catheter on my female client today. So before I enter the room, I would check and make sure I have a physician order and see the size of the catheter that he wants me to insert. In this instance, I'll be putting a 12 French in. I would check and see if my patient has any allergies to betadine or latex. And then I would also check the last void time of my patient and the amount of urine that she voided. So once I have all those things checked off, I'd go ahead and enter the room. Hi, Mrs. Smith. My name is Bailey and I'll be your nurse today. I'm gonna go ahead and insert a Foley catheter in you today so we can remove some of that urine from your bladder, okay? Can I have you go ahead and identify your name and date of birth for me, please? Awesome, okay. And you don't have any allergies to betadine or latex, do you? Great. I'm gonna go ahead and raise you up to a working height. And I'm gonna lean you back. You just let me know if you're uncomfortable at all, okay? Okay. So I'm gonna go ahead and expose you, okay? And I'm gonna position your feet. All right. And then I have a bath blanket for you. This will kind of keep you warm, keep you a little bit covered as best as we can to maintain privacy. All right, so I do hand hygiene again, and then go ahead and put on clean, non-sterile gloves to clean the vagina before the procedure. Okay, Mrs. Smith, you're gonna feel me start to clean you with a cold wipe. If anything is uncomfortable, you just let me know. So I'm gonna start by gaining control of one corner of the wipe. And I'm gonna wipe down one side first. I'm gonna go ahead and establish a new clean corner of the wipe. Wipe down the other side. And go ahead one last time and get a new clean corner, gain control. Wipe down the middle. And I could go ahead and dispose of all of this. Do hand hygiene once again. Okay, so I can put this stuff to the side. And I'm gonna bring my sterile kit over to the bed. So I can go ahead and open it away from me. Side, side, and towards me. Okay, I'm gonna come over here, and before I do anything else on my sterile field, I'm gonna don my sterile gloves. And make sure to stay in this 1-inch border so I don't break sterility at all. Okay, I'm gonna start by donning my right hand. So I'm just gonna grab this cuff. Insert, and I'm gonna hitchhike my thumb. And insert my left hand. Okay, so now I'm sterile. I can go ahead and come over to my sterile field. I'll shift it over here. Get my drape out. Make sure I am putting the shiny side down and it's not touching my arms at all. I'm gonna go ahead and just set this under the patient and leave it. So that extends my sterile field a bit. Okay, so I'm gonna go ahead and get everything set up before I do anything. Okay, so I'm gonna get my swab sticks out. Put those on sterile field. Open my lube. Okay. So I'm going to go ahead and lube the tip of my catheter 2 to 3 inches for a female, And then I'm gonna leave it right there, and then I'm gonna go ahead and hook up my flush, making sure I have all the air out. I also want to pay attention. I am inserting 10 milliliters into the balloon, so that's how much I will want to get out whenever I'm done. And we can take the catheter out. Okay, so I'll leave everything right there. I'm gonna go ahead and break sterility with my left hand. Mrs. Smith, you're gonna feel me touching down here. I'm just gonna clean you off with some sterile swabs. So I am going to open, and I'm gonna clean one side, drop, clean this side, drop, and go ahead and clean down the middle, drop. All right, Mrs. Smith, I'm gonna go ahead and insert this catheter. I want you to bear down kind of like you're trying to pee. You're gonna feel some pressure down here, okay? 1, 2, 3. So I'm going to insert until I see urine return, and then I'll go ahead and go 2 more inches. So I see urine, 2 more inches. And I'm going to hold this to stabilize it. And I'm going to go ahead and insert my 10 mils of fluid. Doing okay, Miss Smith? Okay. So again, I just want to remember that I'm inserting 10 mils, and I'll document that later on just to make sure I get that amount out. Still holding on to that. Okay, and then I'm going to pull back to see if I get resistance, make sure that balloon's seated in the neck of the bladder. It is. Go ahead and take this out. Okay, so the procedure is not sterile anymore. I'm going to go ahead and give her some slack on this catheter and take my pre-rip tape tape that catheter to her leg, just again making sure there's some slack there so it's not pulling. And I am going to make sure there's no dependent loops in the tubing so that urine can flow easily, and hang the bag lower than where the catheter is inserted. So I'll just hang it right here on the bed, making sure again there's no loops, the urine can flow freely, and that this is clamped off so urine doesn't come out. Okay, so I can go ahead and clean this up. I would also take my sticker and name, date, time, initial, and put it somewhere where the catheter is inserted, just so people know when the catheter was last inserted and who did it. Okay, Mrs. Smith, we're gonna kind of get you cleaned up here. So I would dispose of the entire Foley kit for video purposes. I'm just gonna put it to the side. Take off my gloves and do hand hygiene. All right, Mrs. Smith, we'll get you covered back up here. Okay. And then I would make sure I lower her all the way down, do the safety checks, make sure she has her call light with her, has all of her personal items that she needs. That's not wanting to. I would make sure she was lowered all the way down. She had her call light with her. Make sure her legs are back in a comfortable position. Miss Smith, do you have any questions or concerns? Can I get you anything? Okay, great. So once I left the room, made sure she didn't need anything else and she was safe, I would document the size catheter that I put in. I would document obviously how many mils I inserted into the balloon. I would document the urine that came out of the tube, the characteristics and the amount. And then I would also document how my patient tolerated the procedure. So after all that's done, we get an order now to take the Foley catheter out. So I'd go back into my patient's room. Hi, Mrs. Smith. My name's Bailey. I'm your nurse. We're going to go ahead and take that Foley catheter out. So before I came in here, I would make sure that I had a physician's order to remove the catheter before I came in. Mrs. Smith, I'm going to go ahead and expose you here so we can get this catheter out. It shouldn't take too long. Make sure I provide privacy to her. Raise her up to a working height. Can you go ahead and identify your name and date of birth for me, please? Okay, awesome. All right. So I'm just going to get some clean non-sterile gloves on for this. So we're gonna take your Foley catheter out. You shouldn't feel any pain, maybe just a little bit of pressure, but no pain. So let me know if you're uncomfortable at all. I'm gonna put this little towel down just to make sure if any urine happens to fall out while we're taking it out, that it will catch it. Position your legs here, Mrs. Smith. Okay. Alrighty, so I'm just gonna remove this tape right now from her legs. And then I'm gonna take my syringe here, make sure there's no fluid in it. And I know that I inserted 10 mils into it, so I wanna make sure that I can get that back. So I'm gonna remove as much as I can right now. Again, I should get 10 milliliters that come out. Okay, so I got 10 milliliters, but I'm gonna do it one more time just to make sure I don't cause any trauma to the urinary tract. All right, so all the fluid's out. I'm gonna just stabilize this. Miss Smith, you're gonna feel a little bit of pressure, but like I said, it shouldn't hurt, okay? I'm gonna take this out in 1, 2, 3. Okay. I'm gonna remove this catheter bag. Before I did the procedure, I would obviously make sure to drain the urine out of the bag so it didn't go everywhere, and I would document how much urine was in the bag. I would fold all of this up, and obviously I would dispose of that, but for video purposes, we'll keep it. I would go ahead and clean her off if I needed to with a wipe. Cover her back up. All right. I'll lower you back down here. I'd make sure that she had her call light and everything she needed with her. Do you need anything, Mrs. Smith? Okay. Again, just make sure she has her call light and has all of her personal belongings with her. Do hand hygiene. Whenever I left the room, I would go ahead and document that I took out the catheter, how many mils I got out of the balloon, and then I would also document the amount of urine I took out of the bag, the characteristics, and the time all of this happened, and how my patient tolerated the procedure. That's it.